Respected audience, Assalamu alaikum. I am Professor Shamsuzzaman, Professor of Pathology. I welcome all in today's 16th lecture on systemic pathology. Today, day 5 of liver diseases. Today's topic is Hepatocellular Carcinoma and Cholangiocarcinoma. Hepatocellular Carcinoma and Cholangiocarcinoma. Dear audience, before going to discuss about hepatocellular carcinoma and cholangiocarcinoma, we want to recapitulate the tumors of liver. Tumors of liver may be benign tumor and malignant tumor. Benign tumor and malignant tumor. Benign tumors may be liver cell adenoma, bile duct adenoma, benign tumors may be liver cell adenoma, bile duct adenoma. Malignant tumors primary tumor, may be hepatocellular carcinoma, cholangiocarcinoma, hepatoblastoma. Dear audience, primary tumor, hepatocellular carcinoma, cholangiocarcinoma, hepatoblastoma. You know, hepatoblastoma is a childhood malignant tumor. Secondary tumor of liver. So these are the tumors that may occur in the liver. Now come to hepatocellular carcinoma. Carcinogens associated with hepatocellular carcinoma. Carcinogens associated with hepatocellular carcinoma. One is hepatitis B virus, hepatitis C virus. Dear audience, you know hepatitis C virus and hepatitis B virus are the oncogenic viruses, and these are associated with carcinoma of the liver. Aflatoxin B1 of Aspergillus flavus fungus. Aspergillus flavus fungus. This aflatoxin B1 of Aspergillus flavus fungus is associated with hepatocellular carcinoma. Dear audience, we know cirrhosis of liver may turn to carcinoma of the liver. Aflatoxin B1 is associated with mutation of mitochondrial DNA. Aflatoxin B1 of Aspergillus flavus fungus is associated with mutation of mitochondrial DNA. Cirrhosis of liver serves as promoter for action of aflatoxin B1. Dear audience, we know there is two steps of carcinogenesis. One is initiation, another is promotion. Cirrhosis of liver serves as promoter for action of aflatoxin B1 toxin. Now come to morphology of hepatocellular carcinoma. Hepatocellular carcinoma. Gross examination. Gross examination reveals bile-stained mass in liver. Gross examination reveals bile-stained mass in liver, and the mass may be unifocal, multifocal, or diffuse infiltrative. The mass may be unifocal or multifocal or diffuse infiltrative. Whatever may be the type of mass, either unifocal or multifocal or diffuse infiltrative, the mass is bile-stained. FNAC reveals anaplastic cells and the cytoplasm of the cell is bile-stained. Cytoplasm of cell is bile-stained. These are the anaplastic cells. Large hyperchromatic nucleus, nuclear cytoplasmic ratio altered, prominent nucleoli. These are the anaplastic cells, and the cytoplasm of the cell is bile-stained. Dear audience, now come to histopathology. Histopathology reveals well differentiated adenocarcinoma. Cells are arranged as trabeculae or arranged as acinar pattern. Anaplastic cells are arranged as trabeculae or as acinar pattern. The cells may be undifferentiated also. Undifferentiated cells. These are the anaplastic cells arranged as acinar pattern. This is the histopathology of hepatocellular carcinoma. Now come to laboratory diagnosis of hepatocellular carcinoma. Laboratory diagnosis of hepatocellular carcinoma. Ultrasonography, CT scanning, FNAC, biopsy, and histopathology. Ultrasonography, CT scanning, FNAC, biopsy, and histopathology. Tumor marker. Ascitic fluid analysis. If there is ascites, tumor marker in hepatocellular carcinoma. Tumor marker in hepatocellular carcinoma. Dear audience, in hepatocellular carcinoma, there is high titer of alpha fetoprotein. High titer of alpha fetoprotein. This is tumor associated antigen. Ascitic fluid analysis. Patient suffering from hepatocellular carcinoma, if there is ascites, the malignant cell may exfoliate from the tumor mass in the ascitic fluid, and if you do exfoliative cytopathology, we can get the anaplastic cells. We can get anaplastic cells, pleomorphic cells with large and hyperchromatic nucleus, altered nuclear cytoplasmic ratio, prominent nucleoli. These are the characteristics of anaplastic cells. So we can get anaplastic cells. Along with the anaplastic cells, degenerated mesothelium. Dear audience, this is up to the hepatocellular carcinoma briefly. Now come to cholangiocarcinoma. Dear audience, cholangiocarcinoma is a desmoplastic tumor. That is, in cholangiocarcinoma, the stromal element is more than the parenchymal elements. Morphology of cholangiocarcinoma. Gross examination reveals non-bile stained mass. Dear audience, in case of hepatocellular carcinoma, we get bile stained mass, but in case of cholangiocarcinoma, non-bile stained mass. Non-bile stained, and the mass may be unifocal, multifocal, or the mass may be diffuse infiltrative. FNC reveals anaplastic cells with non-bile stained cytoplasm. Anaplastic cells with non-bile stained cytoplasm. Histopathology reveals well differentiated adenocarcinoma. Dear audience, I have told you it is a desmoplastic tumor and you will get stromal cells. Stromal cells. This is all about the cholangiocarcinoma. Briefly, dear audience, today I have told you about the different types of tumor of the liver. There may be benign tumor, adenoma, liver cell adenoma, bile duct adenoma, malignant tumor, primary malignant tumor, hepatocellular carcinoma, cholangiocarcinoma, hepatoblastoma. Hepatoblastoma is childhood malignant tumor. Besides this, there is secondary malignant tumor. I have told you about the hepatocellular carcinoma, the carcinogens associated with hepatocellular carcinoma, hepatitis B virus, C virus, aflatoxin B1 of Aspergillus flavus. Grossly, the tumor is bile stained mass and the mass may be unifocal, multifocal or diffuse infiltrative. FNC reveals anaplastic cells with bile stained cytoplasm. Histopathology reveals well differentiated adenocarcinoma or undifferentiated carcinoma. Cholangiocarcinoma, grossly non-bile stained mass. FNC reveals anaplastic cells with non-bile stained cytoplasm. Histopathology reveals well differentiated adenocarcinoma and there is stromal cells because it is desmoplastic tumor. For diagnosis of carcinoma of liver, we do ultrasonography, CT scanning, FNC, biopsy and histopathology, tumor marker, ascitic fluid analysis if there is ascites. Dear audience, this is all about the hepatocellular carcinoma and cholangiocarcinoma briefly. Today up to this, thanks all.